ठीक है. Okay. So I think, sir, we can start. Huh? Next, karo slide. So welcome you all, sir. I feel honored to welcome Padma Shri Dr. Mahatme. He is a member Rajya Sabha, and Professor Dr. Radhika Tandon, RP Center AIMS, Mr. Kumar Rahul, Secretary Health cum MD NHM Punjab. So he'll also likely to join us. So Padma Shri Professor Dr. Jagatram, Director PGI Chandigarh. Dr. Jagdeep Singh Basoor, he is SPO NPCB Haryana, he is with us. Dr. Rana Singh, SPO UT Chandigarh. They are looking after NPCB program. So Professor Dr. Sonu Goyal from Department of Community Medicine, PGI. Dr. Rana J. Singh from the Union. Mr. Arun Verma, he is Director Finance and Operations with Cypher. All our panelists, Dr. Shok Sharma, Dr. Shakeen Singh, Dr. Amit Gupta, Dr. Ramesh, Dr. Rohit, they are all our Cornea heroes. They were awarded Cornea Hero Awards last year. The attending ophthalmologists, NGOs who have been associated with us in CBBF, that is Cornea Blindness Backlog Free Movement since 2015, the Department of Community Medicine, PGI, NPCB and VI, and all the participants on Zoom. So you are all welcome, sir.
Thank you.
Next. So, sir, the National Eye Donation Fortnight, it is observed every year from 25th August to 8th September, as everybody knows. And it is a campaign that aims to create mass awareness about the importance of eye donation and to motivate people to pledge their eyes for donation after death. So as we know that because of COVID-19 pandemic, there is an unusual fallout. Eye donations have seen a drastic fall. Nationally, fewer donations have led to a serious shortage of the corneal tissue, which are needed for transplants to restore the vision in people suffering from loss of eyesight due to irreparable damage of the tissue. There has been a decrease in eye donations and number of keratoplasty surgeries during COVID pandemic. The opportunity that exists for us, for all the eye banks to grow rapidly and sustainably by leveraging global best practices with the leading eye banks. Many eye banks, the in charge of the eye banks, they have joined us. And against this background, actually, Cypher and Department of Community Medicine and School of Public Health, PGI MEA, we have planned this event in collaboration with National Program for Control of Blindness, Punjab, Haryana, and UT Chandigarh. So all are welcome. Next. So I'd like to introduce Dr. Jagdeep Singh Basoor. He is SPO NPCB and VI Haryana. And Dr. Rana Singh, he is SPO NPCB VI UT Chandigarh. So kindly, Dr. Basoor, you may present your report first and the suggestions to improve the situation. So Dr. Jagdeep Singh, are you with us?
Yeah, I'm with you, but
Okay.
I am unable to share, sir, my PPT. Kindly allow. You have disabled the participant screen sharing.
Now, try now, sir. Try now.
Try now, please.
Yeah. Good afternoon, everyone.
Yeah, you are audible.
At the outset, I would like to thank all the organizers, seniors, especially Dr. Rakesh Gupta sir, for giving me this opportunity. Today, I would like to highlight some of the initiatives which we have taken in the last 1.5 years to reduce corneal blindness in the state of Haryana. As you are all aware that
all except speakers may please keep yourself muted. Dr. Harpreet, please keep yourself muted.
as you are all aware that corneal blindness is the major contributor to the load of blindness. In the persons above 50 years of age, it is second leading cause after cataract, contributing to almost 8.2% to the load. In the younger age group, it is the leading cause of corneal blindness, contributing almost 38%. Canada is committed to clear the corneal blindness backlog from the state. In this direction, we have taken a landmark decision. We are providing aid of 7,500 in addition to 7,500 being provided by Government of India for each case of keratoplasty being done by free by NGOs, private practitioners or medical colleges. I am happy to share that there is no pending liability toward any NGO or private practitioner in the state of Haryana. We are in the process of establishing 3 new eye banks in the government medical colleges, Karnal, Mewat and Sonipat. We have already sanctioned and transferred 40 lakhs each to all of them. This will make all the medical colleges proficient with eye bank. We have started, last year we started 22 new eye donation centers in all the district hospitals of the Haryana. We have sanctioned and put in place 22 eye donation counselors in each of the district hospitals. There was some shortage and a problem in some districts, shortage of ophthalmologists. To resolve this, we have trained 66 of our paramedical ophthalmic assistants in cornea retrieval programs. We gave them training from different government and registered private eye banks, and now they are certified for corneal retrieval and they are doing excellent job. We have a dedicated 108 toll-free number. Anybody who is willing to donate cornea can call 108. In 2019-20, we could get 1,660 eyeballs and keratoplasties were 608. During the financial year 2020-21, as pandemic raised, we could achieve 534 keratoplasties and eyeball collection were 854. In the current year, up to July 2021, we have done 163 keratoplasties and eyeball collections were 249, despite first quarter being washed out due to second wave of the COVID. 35th National Fortnight was celebrated all over the state with the zeal, newspaper ads, radio jingles, TV interviews, hoardings, and pledges were made. In future planning, we are planning to survey in the community for the load of corneal blindness in the state and will bring all the corneal blind patients who need keratoplasty to the private practitioners, eye banks or registered NGOs. We are also planning to start keratoplasty at some district hospitals after suitable training of eye surgeons. Thanks for the patient listening. Thank you.
So thank you, Dr. Jagdeep. I think Haryana is doing pretty well in eye banking, and we are sure that with the SPO and PCB like Dr. Jagdeep, so it will progress. The situation will improve post pandemic, and we all the states, they need to learn from him. So thank you, Dr. Jagdeep. So Dr. Rana, are you with us?
Yeah.
Dr. Rana,
Hello.
NPCBUT, yeah. Hanji, boliye.
Good afternoon, everybody.
Yeah, good afternoon.
Dr. Rana Singh. I, on behalf of this national program officer of this NPCB Chandigarh, we have about 4 centers in our state. 2 are the government and 2 are privates. And the total cornea collection for the year of 2020 and 21, we have about 170 cornea collections, and we have utilized 161. That is, keratoplasty done in the year 2020 and 21 is 161. Okay. Now this program. Anything else, sir?
So, Dr. Rana, do you have any future plans to improve the situation? If you want to have more eye banks or eye donation centers, you may tell about that.
Eye donation centers, we have only 4 eye donation centers. We may improve this one. Any other, if anybody, other center will come. Otherwise, Dr. Ashok Sharma's cornea clinic and that Bharat Vikas Parishad, these are the 2 privates. centers are here with us. And PGI and the sector Batti GMCH is also.
Okay. Okay, thank you, Dr. Rana. So actually in UT, actually Dr. Amit Gupta, Dr. Ashok Sharma, and ophthalmologists in medical college, they are doing extremely good job.
Yes.
And we do hope that the situation, as the situation improves, the eye donations and the keratoplasties will improve.
Yes.
So thank you, Dr. Rana.
Thank
And actually, and as PO NPCB Punjab could not join us, so now I'll request Dr. Sonu. So, Dr. Sonu, can you introduce the guests of honor? Should I do it?
Sir, please continue, sir.
Okay. So we have with us Dr. Radhika Rana, Dr. Radhika Tandon. She's a professor of ophthalmology, RP Center, AIMS, New Delhi. And she has many awards to her credit. So in 1993, she had gold medal by Royal College of Surgeons, Edinburgh. And she has attended Global Eye Banking Leadership Summit in Seattle, US. In 2012, in 2013, she was member of the expert committee for National Organ and Tissue Transplant Organization. In 2015, she was appointed as a technical expert, as I told you earlier also, that because of the efforts of Dr. Radhika Tandon and Madam Vinny Mahajan, she was then Principal Secretary Health, and now she's Chief Secretary Punjab. And they initiated that cornea blindness backlog free initiative. In 2016, she was President of Eye Bank Association of India, Vice President Association of Banks of Asia, Eye Banks of Asia, advisor member of the Global Alliance of Eye Bank Associations. In 2017, she was member of the Advisory Committee National Program for Control of Blindness. And in 2018, she was chairperson NPCB and VI subcommittee on elimination of corneal blindness, MHFW. So Dr. Radhika will request you to let us know about your views on CBBF Punjab and the way forward to improve the situation of eye banking, so post-COVID. So thank you, Dr. Radhika.
Good afternoon, everybody. Respected Honorable Member of Parliament, Dr. Mahatme, Director PGI, Dr. Jagatram Sir, all the respected dignitaries present, and of course the hosts, Cypher Global, as well as the Department of Public Health and School of Community Medicine, PGI Chandigarh. I'm very, very grateful given this opportunity to participate in today's program. And I would like to congratulate you on having shown a tremendous drive and initiative in getting all the right people together, and for also continually thinking what are the hurdles that one faces and always taking steps to improve. The important thing I would like to say is that sometimes we face some problems which are always caught up in a complication, and we're not able to solve it because there are many agencies involved. So that is one problem that we face. And with the help of Dr. Mahatme's words, I think these hurdles can be removed. Simple example often is that there is a tremendous work that the government is doing, and the NPCB and Visual Impairment Program is a wonderful program. But still, sometimes there is a little bit of rigidity in the finances and the way the funds are to be spent. So a little flexibility can be allowed. So for example, the money, when it is released to an NGO or a private institution, it is used in a particular way. But some of the government institutions, they also do require money, but they may not be in the same heading. So even if, say, the consumables for surgery are being provided, but then, say, giving a nice certificate to the donor family or giving some recognition. So sometimes these little things become difficult, and all the eye banks working in government institutions are sometimes having to partner with private institutions and NGOs. So definitely we should encourage this public-private partnership. But still, when our own government is so motivated, we just want it to go to their ears that we want a little bit of flexibility. The other point I would say is that it is remarkable. I would again like to congratulate the government of Punjab, because they have always made it an effort to use their resources to support this activity. Government of Punjab is one of the few governments where even when the rules were passed in 2014, they had modified it according to their state's requirements. So, for example, the qualification of surgeons who can do the surgery, they had modified it according to their state's requirement. The other thing is the price to be charged for the registration of transplant centers and eye banks. Earlier, it was very high. It was something like 2 or 3 lakhs. Then they reduced it, but even then they've kept it a little higher. They've kept it at 10,000, which is also a good thing, because this is a serious issue being registered. So it is a good thing that they have used their own state-specific requirements and they have put. So in this regard, I would say if the government of Punjab is willing, and maybe other states, then again in the rules, they can state one sentence that technically eye is different from the other organs. So being clubbed with all the other organs, it may not be possible to change the act, but we can definitely frame rules specific to eyes and cornea donation. So this is one important fact. If we start changing the act, it I think will be a very big hurdle. We will waste a lot of years. But if we can modify this in the rules, then we can do it within 1 or 2 years itself. And the other thing is, one thing we should be very clear that we should convey to the ministry responsible for the registration, which is health and education, medical education, that registration of any eye bank or corneal transplant center should not be held up. And if it is a case of renewal of registration and they have submitted their application in time, and there may be some technical reason why inspection cannot be held, it should be deemed as continued so that they don't have to stop. Otherwise, many times the eye bank or the transplant center has to completely stop the activity because of the legal requirement. So this is one thing that we can have in the rules only. We can have this sentence that if registration is finished and if the for some administrative reason the inspection is not held, then it should be deemed as continuation and it should be done as soon as possible. Finally, I would like to say that we should not forget that we have a very unhealthy demand for corneas, because we are having a lot of cases which are due to trauma, infection, which are not properly controlled at the right time. So simultaneously, we must make sure that a message should go that corneal infections and trauma should be controlled at the proper time. So we must make sure that the unnecessary requirement for corneas is also controlled. So we have to have, as you said, this is CIPHER, which is going for education of the public. So there also we can have a leaflet to school children, mothers, young mothers, how to avoid vitamin A deficiency and keratomalacia. Similarly, how to avoid injuries to children. For farmers, how to avoid getting very bad infections. So certain things like this, I think also, so at least after 5, 10, 15 years, this 38% of the young 0 to 49 group, 38% corneal blindness, I think that can be controlled by proper education. So once again, I would like to congratulate everybody. All the work that you are all doing is tremendous. And this systematic approach of having an idea of how many corneas are needed and the sharing of resources across agencies and across states, I think this is a wonderful model, and I really congratulate all of you. Thank you so much.
So thank you, Dr. Radhika Tandon. So actually, I shared with Dr. Radhika Tandon a draft recommendations, list of draft recommendations, and what are the issues which are ailing us. And I also shared it with Dr. Vikas Mahante. So they are now actually well aware already, because they are passionate people in eye banking. And Mr. Kumar Rahul, he is our MD NHM, come Secretary Health. So he couldn't join us, but I may let you know that he's a 2000 batch cadre, a Punjab cadre IAS officer, and he has served as Deputy Commissioner in many districts of Punjab, and has also held very prominent posts like Secretary Home before being appointed as Secretary cum MD NHM Punjab. And he is very proactive as an administrator and who is doing a very good job. and we'll convey the deliberations of this consultation to him as well. So now I like to request Padma Shri Professor Dr. Jagatram, who is the Director PGIMER Chandigarh, and he is a very eminent ophthalmologist, as we all know. He is Director of PGI Chandigarh. He received the Oscar of Pediatric Ophthalmology at the World Congress of Pediatric Ophthalmology and Strabismus in Barcelona. He assumed the office of Director at PGIMER in March 2017, and he was conferred with Padma Shri Award by the President of India in January 2019. In 2021, actually, he has completed now 42 years in PGIMER. So you are welcome, sir, and you may please guide us how to about the way forward to improve the eye banking.
Thank you very much, respected Dr. Vikas Mahatme, Padam Shri, Honorable Member of the Rajya Sabha, and Chief Guest of this function. We have a guest of honor, Dr. Radhika Tandon, from Dr. RP Center of Ophthalmic Sciences, New Delhi. We have with us Dr. Rakesh Gupta, President and Director of the CIFER, Professor Sonu Goyal from the Community Medicine PGI. We have several other faculty, such as I can see Dr. Ramesh from Ludhiana, who has done excellent work in the field of eye banking as well as actual corneal transplantation. We have Dr. Jagdeep. Already he has shown how well Haryana has done for the last few years. We also have Dr. Karamjit Singh, who is from Medical College Amritsar, and he is also doing excellent job. We have Dr. Ashok Sharma, who is a pure corneal surgeon and doing excellent job in the field. Dr. Rohit Gupta. In the private sector, they are also doing a lot of eye banking. And Dr. Amit Gupta, of course, he is doing very advanced surgery and corneal transplantation and lot of eye banking. I think in this meeting, we have Professor Dr. Vikas Mahatme, who is an inspiration for us and has done excellent job. I think lot of eye banks were set up by him at a lot of places, and he can definitely help us, as Dr. Radhika Tandon also mentioned. And we also have a lot of inspiration from Dr. Radhika Tandon. So first of all, I will like to congratulate Dr. Rakesh Gupta and Dr. Sonu Goyal for organizing this webinar celebrating eye donation fortnight, activating the eye banking post-COVID. I think there were a lot of retardation, or there was a lot of problem due to COVID-19 pandemic. Last year it was much more, but now we are regaining our eye banking as well as actual donation. So the in short, I can say, because there will be detail after inauguration, there will be a lot of discussion. I can say that our aim of this fortnight is to increase the awareness of the eye donation, that we should pledge for eye donation. And the aim of this awareness is that at the same time, we should also increase the actual donation. And that actual donation, even people don't know that how much, how many hours we can, after we can take the, inoculate the eye, such as 6 to 8 hours or like that. So we give all this education to the, in the awareness. And another good point already said by Dr. Radhika, that there should not be any obstacle in the registration. Once I think person or the eye bank where we have to develop the new eye bank, have all the facilities, and all the prerequisites are fulfilled, I think we should give them a registration. I can say that detail already it will come up. I will say I thanks Dr. Vikas Mahatme for gracing the occasion and chairing this webinar. And at the same time, I am thankful to Dr. Rakesh Gupta and Dr. Sonu Goyal for organizing this webinar. And also thanks to Dr. Radhika Tandon who have joined us. And thanks to all the members and the faculty from different places. I conclude reiterating my commitment to the cause of with the slogan Netradan Mahadan, Angdan Mahadan. Because whenever we hold any of the meeting in PGI or in the neighboring state, then we always have organ donation along with eye donation. So because we at PGI, I think our even cadaveric donation, we have one of the best in the country. Thank you very much.
Thank you, sir. Thanks a lot for your advice. And I'm sure that under your leadership, so PGI actually is already doing wonders. And in the field of eye donation and organ donation also, it will do well. Thank you, sir. So now it is my proud privilege to welcome Dr. Vikas Mahatme. He is a Padma Shri awarded eye surgeon of international repute. He is a firm believer of Mahatma Gandhi's ideology of democracy, peace, and truth. Dr. Mahatme has been leading the team of 150 plus through his several hospitals. He has been the founder medical director of Mahatme Eye Bank Eye Hospital, Nagpur, which is a recognized postgraduate teaching institute run by SMM. He has been the founder medical director of the Mahatme Eye Bank Eye Hospital, Nagpur, which is a recognized postgraduate teaching institute by the SMM Eye Welfare Charitable Trust. So I think this is repeated. The trust that was started by him in a small room in 1986 now treats nearly 65% patients free of cost. And so far, the hospital has performed over 180,000 surgeries. And actually, he himself has performed more than 1 lakh surgeries till date. And he was the first to start an eye bank in Vidarbha and establish the eye donation movement there. His contribution to the community eye care as a social worker, as a philanthropist, brought him the 3rd highest civilian award, Padma Shri, at the hands of Honorable President of India in 2010. He has been a teacher for postgraduate students in ophthalmology, and the International Council of Ophthalmology recognizes him as a faculty. He is associated with the NPCB member AAO, American Academy of Ophthalmology, and All India Ophthalmological Society, Delhi Ophthalmological Society, and many more societies. He is ex-president Geriatric Society of India. He works with many international NGOs like Sight Savers, HelpAge India. He has developed a pigment for corneal tattooing. He has developed his own woodcutter nucleus tracking technique for phacoemulsification. And rectal mucous membrane graft for dry eye syndrome has been his exclusive and pioneering contribution. So we welcome you, Dr. Mahatme. So please guide us on this issue.
Thank you, Dr. Rakesh Gupta. Am I audible?
Yes, sir. You are audible, sir.
Good afternoon, everybody. It's a great privilege to be associated with you all people and share my thoughts with you all on the occasion of Eye Bank Eye Donation Fortnight and post-COVIDly, how can we increase the eye donation with that challenge we are getting together. Basically, what we want is that every corneal surgeon should not think about whether he will get the cornea or not. He should be able to perform his duties and whatever he feels surgical work he has to do. He should concentrate more on that, and we will organize on this way that cornea will be surplus for every corneal surgeon. So it is a nice initiative. I shall like to thank Dr. Rakesh Gupta. It was good to hear Professor Jagatram, who is director as well as Padma Shri awardee. And then Radhika Tandon also, she has shared her views, very important and practical. I heard Dr. Jagdeep as well as Rana Singh. And I think I shall also like to share my views because, as already been told by Dr. Rakesh Gupta, I started iBank in 1986 in Nagpur. But I still feel that the challenge has not been resolved to that extent, though nearly 35 years have lapsed. So we have to still work on it. So I am also partly responsible for that. I don't say that, but collectively we can go ahead and definitely eye donation will increase. What has happened, even the data which was shown by Dr. Jagdeep showed that the eye donation has reduced in numbers because of COVID. What thing which should be done, at least now, is that whenever death is there, we should do post-death the RT-PCR of every person. So that what will happen, nowadays, there is a gray area, whether the patient or the deceased was suffering from COVID or not. Even if there is some doubt, we say we will not take the eyes. So let us have the facility of testing RT-PCR after every death, which is not due to COVID or suspicious of COVID. So that what will happen, at least few percent of people who want to donate eyes will be able to donate, because that question mark will be solved. That is my feeling. And how it can be implemented, that we will have to work it out. Second is, I told you that we are doing very well, but still we are unorganized as far as eye banks are concerned. What I mean by unorganized, I tell you. What is my proposition is that we should have Apex Eye Bank in every state, and then we should have a district eye bank in every district, and then eye donation centers whenever at every taluka level, so that it becomes a structured eye bank. Today we are missing that. Unless and until we have a structure, I feel we are working hard, but the results and outcome is not as expected. And that's why if it is in a structured format, that will be better. Of course, NGO participation is very important. And let us not call it as public-private, it is NGO, because public NGO participation. Because if you say private with iBank, then people have a doubt in mind. Because why private people should be there, something like that. So it is better to say public and the NGO trust. So what is important is the structured way of iBanking. And if more number of iBanks come, that is okay. But we should have one Apex in every state, then one district and eye donation centers at taluka level. And then other iBanks, if they want, they will be able to contribute also. And this will be continuous training. The Apex eye banks will give continuous training to paramedics so that they will be able to retrieve cornea. Sometimes I feel we should remove eyeballs completely because they can be used for research purpose. Because only corneal removal may not be that much beneficial as far as research is concerned. So, but it's we have to decide what to do. But we should have a structured format for the iBanking. Second is, as you have a good thing that you have one phone number. We have in Maharashtra one phone number, 1853, but it's not working, unfortunately. And the thing is that this is this health is a state subject. So, of course, the rules and regulations are there from the central government, but the legal format is from, say, central government. And as Dr. Rana, as Dr. Radhika told that we should have some changes in the rule which are applicable to cornea only. That is very essential. And that way we should have some changes in the rules. And if there are needed, the rules, if you give me the things where the changes are needed, I shall pursue it to the government also. So it's better if it comes through director or your institute. That is far better because it becomes more easy. That was about phone number. Then what I wanted to that rural area is not covered under eye donation. That is a great challenge as far as our state is concerned. Haryana and Punjab will have the same thing because they also want to donate the eyes, but the collection from the rural area, if you see, is not as much as from the district level or the district level. That is the difference because we are not able to reach. It is not that the people do not want to donate. We are not able to reach to them. That is very so. That is the area where we can work more and we can increase the eye donation. And last time also I told that hospital corneal retrieval program is the only way to have a good quality of eye donation, and that should be promoted because in hospital corneal retrieval program the cause of death is known, the blood sample can be taken up easily, the sudden deaths are there, and they say there the eye donation, if it happens, the cornea will be of good quality. So how can we stress this HCRP program, hospital corneal retrieval? That we will have to decide and take up as the first important thing which we have to promote. Of course, through this, we want that eye donation should increase by general awareness. And last time also told, I shared in Chandigarh with Professor Jagatram and other people that let us have some certain rule, like if hospital late is there, the relatives should sign that we are not willing to donate any part or donate eye of this, our deceased nearest kith or kin. So what will happen? They will think of whether we should donate or not. And they will decide that I do not want to donate, and then only they will sign. And then they will get the death certificate. So they have to think twice before signing that. Otherwise, many times what happens, I've seen that people will say, oh, I forgot that time. I wanted to donate, but I forgot at that time, and it was because they are in grief. So can this be in a rule format? Of course, many of the things which I have suggested really are my responsibility also. I do not shun away from that. So if you give me some papers or some proposition, I shall follow it with the central government, and we will together, we can increase the donation, and gradually it should be in such a way that we need not bother too much about getting cornea, which still we have to work on it, especially the clinical surgeons, means clinical people also. So let us, as now onwards, we take this movement forward, and I shall like to congratulate Dr. Rakesh Gupta for organizing such a wonderful seminar on this topic, and I hope definitely this will increase the eye donation in near future, because today there is a crunch of getting cornea, and that will be solved. I'm very much thankful to all other members who are participating. Many of them I shall not be able to see, but I am very much thankful to them. Thank you. Thanks a lot.
So thank you, Dr. Mahatme. And a very good piece of advice that we should do RT-PCR of all the death cases and those who are non-COVID, at least we can motivate the families to donate eyes. And we should have an Apex Eye Bank in all the states. And we are actually trying to get an Apex Eye Bank in Punjab. And there should be eye donation centers in all the districts, and preferably at Tehsil level as well. And as you said, that eye bank as a whole can be retrieved. So these can be used for research purpose. And there should be a there should be a state level toll-free number. So that is also a good suggestion. And as suggested that by Dr. Radhika, there should be some changes in the rules for THOTA and rural areas. We need to motivate people in the rural areas for more collection of the eyeballs, and HCRP definitely it has to be activated. So thank you, sir. And before we have a snapshot of all who are present, so I'll request Dr. Sonu Goyal to give his public health point of view regarding eye donation. May I ask all to please switch on their videos? All are requested to switch on. Yeah. And Dr. Sonu Goyal. So
Yeah,
he's the, yeah. Yes, Dr. Sonu Goyal.
Thank you, Dr. Rakesh. I think it's wonderful to be a part of community for which I have very little knowledge. I am from public health public health background, but over a period of time when I had been associated with Dr. Rakesh in Cypher, so I have learned something about eye, and it's really nice to see a very good bunch of people who are really motivating, and I have seen presentations from Haryana, Punjab, Chandigarh. So it's really motivating to see, I think, all individuals working very hard for this eye bank. So I'll not give, I have couple of suggestions from the public health point of view to increase eye donation. As Sir Dr. Vikas Mahatme has said, that in rural area, we have very little eye donation actually, which is coming from there. Yeah. So like community medicine department or public health department are present in almost each and every block in our, and these blocks are attached with the medical colleges. So that is, I think one point which can be taken here is that they can be involved in the coordination, all community medicine department from there are 650 medical colleges. If they are involved along with the eye department, so we can increase eye donation from the rural area, because they can help in increasing the IEC education activities in the areas. And I think we can have much more eye donation from the rural area. So I think this is one suggestion. The second suggestion is, I think we must have many models which might be working very well. And as Dr. Vikas has said about the center which he has been leading, and I think many surgeries has been done. So I think these models can be showcased to such models which might exist in some of the other part of the country, might be showcased to see that this is the system where the eye donation has been working, and all the management information system is working very nice. So these systems should be highlighted and maybe awarded at some other forums. So I think these are just a couple of suggestions from the public health point of view I want to make it here. And I really want to thank Dr. Rakesh for involving me in this very important webinar. And somebody rightly said that this is one of the webinar which is unique in the sense that we have two luminaries in form of Padma Shri, which is present here. I think it's really nice to be in this function. Thank you.
So thank you, Dr. Sonu. And your suggestions will add to the recommendations which will emerge after this panel discussion. So I'll now request all to please switch on their videos and we'll have a snapshot. So Dr. Mahendra, can you have the snapshots, please? Those who are not switched on the video may please switch on, please. So that all are covered. Yeah. Dr. Mahendra?
Yes, sir. I'm taking this screen.
Yeah. So is it done?
Yes, sir. Yes, sir.
So thank you. And now we'll proceed to the panel discussion. So the inaugural session is over. So because Dr. Vikas Mahatme, he had to attend another meeting. So sir, yeah. But if you have time, you can just continue. Otherwise, you will leave.
No, I want to leave actually 3:30, but it's okay.
Okay, thank you, sir.
I got good. Thank you for everything. Thank you.
Thanks, sir. Thanks, sir. So now Dr. Sonu Goyal and me, we will be moderating the panel discussion. So we have with us Dr. Shakeen Singh, Dr. Karamjit Singh, Dr. Ashok Sharma, Dr. Amit Gupta, Dr. Ramesh, and Dr. Rohit. They are all our Cornea heroes. They were awarded Cornea Hero Awards and last year during the eye donation fortnight. So, Dr. Sonu, so are you with us?
Yes, Dr. Rakesh, I'm very much here.
So the challenges currently being faced by us. So I may just, before we start with the panel discussion, I may just point out to you that we have an inadequate amount of funds being allotted to NPCB out of the funds allotted under NCD pool. Because now we don't have dedicated funds in NPCB, we have to extract it from the NCD pool. So some of the SPOs who are not very active, they may lose on this amount. So I will request Dr. Mahatme to please do something about it. And we should, as earlier, we should have dedicated funds under NPCB. So eye banks, keratoplasty centers, they are not getting timely reimbursement for procurement of the tissue and surgeries performed under NPCB. This is a very common problem, especially with the NGO eye banks. So efforts at increasing collection from government medical college hospitals and district hospitals, they are till date, it has not been very successful, especially in Punjab. I can say about Punjab. So, but I think in Haryana, the situation is better. The voluntary donations from the community were often not fruitful. And in fact, many corneas they retrieved from such sources were actually not transplanted due to their poor quality, thus underscoring the need for hospital cornea retrieval program, as Dr. Mahatme has also suggested us that it needs to be activated. The eye banks in government medical college hospitals, they are not as active as desired, especially since March 2020 because of the COVID pandemic, as very few corneas are being procured and implanted in absence of the dedicated trained corneal surgeons. So we have problems in government sector, and there are different problems with the private surgeons. So I think we can discuss all the participants in the panel discussion. So they'll let us know their problems and what innovations they have made on their own to activate the eye banking, especially post-COVID. So, Dr. Sonu, can you introduce Dr. Ashok Sharma?
So thank you, Dr. Rakesh. So it's my proud privilege to introduce Dr. Ashok Sharma, who is Director, Cornea Center of Chandigarh, and has more than 30 years of experience in eye banking and corneal transplant surgery. And he was instrumental in establishing Eye Bank Society of Chandigarh, and was facilitated by Doon Society and given state honor by Mr. P.K. Dhumal, then Chief Minister of Himachal Pradesh, for his outstanding contribution in the field of eye donation and corneal transplant surgery. He has been awarded the Achievement Award by American Academy of Ophthalmology and developed major expertise in corneal grafting in children. So received Best Poster awarded by American Academy of Ophthalmology at Chicago, US, for his work on corneal transplant in children. And he has delivered guest lectures on various topics, including corneal grafting in children in Middle East and African Society of Ophthalmology Conference at Bahrain. And besides it, I think he has been, as Dr. Jagatram has pointed out, that he has been doing a lot of work in Chandigarh, and I think he has done many corneal transplant surgery in his clinic. So welcome, Dr. Ashok, to this panel discussion.
So, Dr. Ashok, we can we hear from you? And after that, I'll introduce Dr. Shakeen Singh.
Yes, sir.
Yeah.
Thank you very much for the invitation and giving me opportunity to share my experience. As in the beginning only, I told that this meeting is unique, that we have two guests who are Padma Shri, and it is very rare to have that kind of meeting. And then we had inputs from both Professor Jagatram and Dr. Vikas Mahatme, and we were also enlightened by Professor Radhika from RPC on various issues. In this meeting, probably I am the only person who has experience of both the government setup as well as private setup. And I have been instrumental in iBanking from the very beginning, as early as 1986-85. And in PGI, I was the one who was instrumental in forming the iBank Society and increasing the number of donations from less than 10 to 250. And I left PGI in 2002, and after that I am in private practice. So I have idea of both the sides of the coin, and I will share some of my experiences.
Meeting
as highlighted by Dr. Radhika and Dr. Vikas Mahatme, during the COVID pandemic, iBanking activities were completely shut down, and I think we should be really thankful to the office bearers of iBank Association of India and All India Ophthalmological Society office bearers, who made guidelines and also gave us a lot of guidance to initiate the iBanking again. It was in fact the rebirth of iBanking immediately after pandemic, and among others, Professor Radhika Tandon played a significant role. In my experience, and I think in others' experience also, like optical penetrating grafts or endothelial keratoplasty was completely stopped because we didn't get any fresh corneas. We, as corneal surgeons, had to rely on glycerin-preserved donor corneas for emergency, like if we have a perforated ulcer, to perform therapeutic graft or lamellar graft or DLK. And in emergencies, we were managing corneal melts, impending perforation, actual perforations with these issues. Now, we also used some of the alternate tissues like preserved sclera, amniotic membrane tissue, then Tennant's capsule, conjunctival flaps to treat corneal ulceration and corneal melts and corneal perforations. And also we have some assistant from cyanoacrylate tissue adhesives. These are the adhesives which can seal the perforation if the perforation is very small. We also tried to put few more sutures in, at least in my practice, so that there is no wound leak and patient need not come for follow-up at a very short interval. And we can avoid the resuturing kind of things. So that was how we managed these patients during our COVID time. Now coming to some of the issues which were faced by us in iBanking otherwise also, or during the COVID, we have universal shortage of donor corneas, and that is worldwide. It's well expected, and it is more in the developing world. It is well known, and there are so many studies which have been done and on the prevalence of corneal blindness, and it has been seen that the corneal blindness is more in the north as compared to the south and other parts. But at the same time, the procurement of the donor corneas is also less in the north as compared to the south and other parts. So we need to enhance the procurement of the donors. But at the same time, I would like to highlight that it's not only the numbers that we need, we also need the quality iBanking. Quality iBanking means that the endothelial cell count should be on a higher side, because we have to perform new procedures these days, like Descemet stripping endothelial keratoplasties or DMEC, or pediatric corneal transplants, or regrafts, where the surgeries are complex. You have to manage inside the eye vitreous also, and sometimes lens also, and sometimes you have to do secondary IOL. So all these things are required. And then you have one-eyed patients also. So we need donor eyes with higher cell counts. So for that, quality eye banking should be the focus. And to achieve this focus, I would like to mention that adoption of hospital cornea retrieval program is a must. And you may be surprised to know that, like apart from RPC or like maybe hospitals in Delhi, but not to Delhi, except for PGI, I don't think there is any other hospital which has effective hospital cornea retrieval program. And quality donor eyes can only be achieved through hospital cornea retrieval program, because otherwise we get donor eyes from very aged patients or with other problems where we cannot use these eyes for optical purposes. So this is one thing. And the biggest problem, we have experience of using a hospital cornea retrieval program in practice also, but then there is no direction from the government. So that is the reason the private hospitals or the private eye banks are not encouraged by the multi-specialty hospitals to come and to work under the hospital cornea retrieval program. So if there is a direction from the government that the private hospitals or NGOs can also go for it, then it would be a better thing. Another issue is of delaying donations from the medical legal cases. We are all aware that it is the accidental deaths or the medical legal cases which are the best suited for the corneal transplants.
Dr. Ashok, are you with us, sir? So I think we have lost contact with him. So, I think I'd like to call Dr. Shakeen Singh. So, Dr. Shakeen, are you with us? So, Dr. Shakeen Singh, he's
the problem is because even if we have,
I think Dr. Ashok is back. Yeah. Dr. Ashok, your internet connection is very unstable. So you can join again, but right now I'm calling Dr. Shakeen Singh. So Dr. Shakeen Singh, he is Director Cornea Center, Chandigarh.
Hello.
Dr. Ashok, yeah, your internet connection is very dicey, I think. It's unstable. We have again lost. Yeah, you can continue. So please try to be brief. Another minute.
Yeah.
Yes. Yes, Dr. Ashok, please continue.
Yeah, just a minute. So there should be orders from the government so that the police can permit the donations from these bodies, and doctors who are to perform the autopsies can give the permission so that the valuable time is not lost. Otherwise, these eyes, they become like they cannot be used. There is another suggestion, like if whatever eye donor pledge forms we are filling and cards we are making, instead of that we can have something on the driving license or Aadhaar card. That would be more useful, because if that is there, then the relatives, they cannot say no. Then we have, am I audible, Dr. Rakesh?
Sir, you are audible.
I'm audible?
Yes. You are audible, sir. You are audible.
And that will make a lot of difference. Then the next of kin cannot say no to the donation, because otherwise it becomes difficult at times. They say no, but if the donor has wished it that I am going to donate it, then they cannot say no. The other issue is of medical ethics. I am for it that the medical ethics should be strictly sometimes what happens is that the people are disclosing the identity of the donors to the recipients, and that makes sometimes a lot of problems. I was in PGI, and at that time, somebody has donated the eyes to another family. And I don't know from where they came to know. We never disclosed the identity. But that mother of that donor was after us that I want to meet that person and I want, he's my son, and these kind of problems they arise. And another issue is that the charitable eye banks, they sometimes do not give donor corneas to the corneal surgeons who are in practice, even if the surgeon is willing to give undertaking that he's going to use it for charity. I don't know why. Because I have faced this problem when I left PGI in 2002. I went to the famous Dholka in Gujarat to support me for the donor eyes, and they clearly said, no, we have a policy that we cannot give to you because you are in practice. A reimbursement of the corneal transplant charges to the corneal surgeons are like very less. Through some of the government portals and agencies, it is something like 5,000, with which we cannot even manage to pay the processing charges. So this needs to be taken care of. Another issue to my mind, which is very important for our young cornea colleagues who are aspiring to be corneal surgeons, is that whenever they have to go for the registration of the corneal center or the eye bank, they need a fellowship certificate. And the problem is that there is, like, if you leave aside PGI or leave aside AIMS, there is no other government medical college in UT, Chandigarh, Punjab, Haryana, J&K, HP, Uttarakhand, Rajasthan, who is giving this degree. Corneal fellowship is not given by any of these medical colleges. Then I don't know from where the person has to procure this degree and to present. Another issue is that suppose something happens and somebody, like suppose if somebody has even taken the fellowship from a hospital or a private hospital. Now, if there is a medical legal case, I don't know, this fellowship is not going to protect him in the court of law. That is another issue. So I think these issues should be taken into account to make the eye banking and corneal transplant services safe to the patients as well as to the corneal surgeons. Thank you, Dr. Rakesh. I would like to congratulate you for excellent meeting.
Thank you, Dr. Ashok. So, Dr. Sonu, you may like to comment upon Dr. Ashok Sharma's address. Dr. Sonu, are you with us?
Yes, Dr. Rakesh, I'm with you.
So, should we ask Dr.
continue.
Okay.
Yes.
So Dr. Shakeen Singh is with us. So I'll request all to please restrict yourself to 3 or 4 minutes. So Dr. Ashok Sharma has actually very comprehensively given us all the issues which are important, and will add to the recommendations. So now I'll request Dr. Shakeen Singh to just tell us his viewpoint. And he is Director Cornea Center, and has more than 30 years of experience in eye banking and cornea transplant surgery. He is HOD Ophthalmology and Dean Academics, SDRD, University of Health Sciences, Amritsar. And Dr. Shakeen Singh is with us since 2015 in this initiative, CBBF initiative. So Dr. Shakeen Singh.
Thank you, Dr. Rakesh.
Yeah.
Am I audible, sir?
Yes, you are audible.
So I'm really sorry I joined late because of my appointment. We were in a high purchase committee meeting of the institution today.
Yeah. Thank you.
So I was a bit late to join. And as the time restricted, this is definitely, I would say, it's a very valuable seminar which Dr. Kesh has conducted, and always he would put in something very good for the eye donation and eye procurement and eye transplant process. So you contribute a lot towards corneal blindness prevention and cure program. So sir, I congratulate you under the dynamic leadership of Dr. Radhika Tandon, who's always a guiding force to us in Punjab. So coming down to my suggestions, I slightly believe a bit different view. You see, everybody is talking of eye donation. My concern is eye donated would only be used by the corneal surgeon. So the first thing, we must think of the safety of the surgeon, number one. Wherever he is working, we should take its all interest into consideration and to let him work free of all adversaries. So second thing is the procurement. That I would believe is better if a government can own, at least in my state, at a district headquarter. So anybody from a local center can deliver that tissue to a district headquarter, maybe at any of the civil hospital, which can then be contributed to any cornea surgeon sitting anywhere in that state, or if it's surplus, can be sent to somewhere else. That way, we would have a good quality of tissue and would have an even distribution of the tissue and safety of the surgeon too. The second issue, which I believe is, as Dr. Ashok has already mentioned, about the reimbursement of the cornea transplant surgery, that should be enhanced, because few of our centers in Punjab, they are doing free of cost, and you incur a lot of resources on that. If government can enhance their reimbursement, that definitely would encourage more surgeons to come forward for transplantation. Third thing is about the cornea transplant surgery itself. As Dr. Ashok has already rightfully mentioned, we have no fellowship program in Punjab or nearby. So instead of getting more cornea, we should have pushing more corneal surgeons. So all those corneal surgeons who has a decent surgery, experience, they should be deputed to local centers like Rajendra Hospital, Government Medical College Patiala, Amritsar, and Faridkot, what do you call this? PGI. We can depute them for short trainings, and we push in more corneal surgeons at the district headquarter level, and they would put their own bit, and the corneal transplant can be enhanced. You see, this is a disease of a compromised cornea economic status people. Social economic status is compromised. So most of them, they are working with the hands, working in the fields, or working with the tools. So this, if it's available at their doorstep, would be easy to be delivered to more people. So these are a few of my suggestions, and I would definitely congratulate Dr. Rakesh for putting these efforts and putting us all together to make us aware that cornea blindness is a big issue, which we can only manage with our own efforts. And time to time, he's making us sensitized about this cause. Thank you, Dr. Rakesh.
So thank you, Dr. Shikeen. And you have a very valid suggestion that reimbursement has to be increased. So as we have seen that Dr. Jagdeep Singh has told us that it is already 15,000 in Haryana, 7,500 from government's own kitty. So that is a very good initiative of Haryana government, and I think that can be followed by all other governments. And another suggestion was that since we don't have fellowship of in cornea, so it is better that we depute our general ophthalmologists who are having good skills in cataract surgery to the medical colleges or PGI for short duration, and they can be trained for cornea surgery. So thank you, Dr. Shikeen. And now I'll request Dr. Amit Gupta. So Dr. Sonu, can you introduce him or should I do it?
Yes. And either way, sir, either way.
Achha, Dr. Mehndra, can you project the slide? Or I'll introduce her. Okay.
Yes.
So Professor Amit Gupta, he's doing cornea, cataract and refractive surgery in Advanced Eye Center, PGI Chandigarh. His areas of interest are femtosecond laser applications, LASIK, keratoplasty, intacs, and cataract. So Dr. Amit, we'd like to hear the viewpoint from the government eye banks. So what will be your suggestions how we can improve post-COVID?
Thank you, Dr. Rakesh. Am I audible?
Yeah, you are audible.
My impression was that we'll discuss the challenges faced during the COVID epidemic and maybe carry forward any discussion. A couple of points that one point which was raised was that the financial support, and I think Dr. Rakesh is also well aware that for the past 4 years, PGI Chandigarh has not been given any support from any quarter. Now we have the Eye Bank Society, which is an NGO, and there's almost 40 lakhs due to us. And we are trying our best even at the Government of India level to get it. And anybody who can help us in procuring this will be more than happy. So this is at a rate of 1,000 rupees per cornea collected. We are not getting any payment for any keratoplasty that we do, although we do a huge number of patients who cannot afford it. So the major crippling point for PGI has been lack of financial support, unlike maybe the RPC. Regarding the training program, I think again, when we had the meeting with Mrs. Vinny Mahajan, I think Professor Amit Gupta was the chief advisor at that meeting, and it was decided that for a experienced cornea specialist, a period of 3 months would be enough that they would come to PGI. From the Punjab government side, only I think one person came, and after that nobody came to PGI. But in case anybody wants to train, I'm sure we can carry on from where we left before, and then maybe certify a 3 month training period or something like that. We have got a couple of people from J&K also in the past who have spent some time there and received some kind of a certificate, which is something is better than nothing. We do have an MCH in cornea, cataract and refractive, but of course that is very difficult, and it may be very difficult for a person who's advanced in his career to go back to that. I would like to share a few slides with the permission of the chair. Dr. Rakesh, can we share?
Yes, sir, you
Yes,
can
sir,
do it.
you can share.
You can share.
Is my presentation visible? Is it visible?
It is visible. It is visible.
Just very briefly, I was looking at this publication, which is impact of the nationwide COVID-19 lockdown on keratoplasty and eye banking. So this was in February 2021. So the average number of corneal transplantation, the period of, that major lockdown, April to May 2020, was less than 2 corneal transplants were being done by over almost 80% of the corneal surgeons. So that was how bad the problem was. But we in PGI especially, and I'm sure other corneal surgeons were getting such severe cases which required either an emergency intervention or the eyes would be lost. As far as our figures were concerned, pre-COVID we collected 600 eyes, and we were down to about 132 eyes, and our corneal transplants also came down to 113 in the post-COVID era. So we were close to 400 pre-COVID. But things are picking up, and in fact, in August, from 1st August till date, we have now collected 104 eyes and performed 60 corneal grafts. So we are getting back in action with our measures, but still, what are the challenges faced and what measures have we initiated in PGI? One is the donor screening is being done very stringently as per the guidelines which have been issued by the Government of India, and we are collecting only from those donors which are having a COVID negative report, not more than 48 hours before death. And what we do is there's a proper donning and doffing. So PPE kit is used, and because there is a eye bank counselor or involved, there's a resident involved, and there is a person who processes the eyes. So 3 PPE kits are needed for every pair of eyes that we collect, and this is given by PGI free of cost to the eye bank. Residents are trained in how to handle through the CD ward. They are trained by the PGI specialists how to handle, how to don the gowns and not to contaminate. So a nasal swab is collected from each person, each donor, and it is sent to preferably for gene expert, and we get the report within an hour, and then the sample. So this is the kind of a COVID sampling, the viral transport media and the swab, which is then received, and it is transferred in a cold chain through ice bomb, and we get this report, and then we process the eye further. This is the ICMR specimen referral form that is being used, and this is what is then submitted to the virology department. So it's added a lot of paperwork to us also when we are collecting the eyes. Even while processing the eyes, as per the guidelines, all the performers and the papers are exposed to UV lights for 30 minutes in the laminar flow hood, and the processing is done, and all the routine samples, the viral testing and markers we are doing. So after that screening, the resident doctor on duty assesses the corneas, and this is then stored. The major thing that we achieved was inclusion of the MLC cases. I would specifically like to thank Professor Yogendra Bansal, who's the young dynamic HOD of the forensic medicine. And you'll be surprised, out of the 74 eyes that we collected during COVID period, out of the 132 eyes we collected, 74 were MLC eyes. And before that, we had such a big problem trying to get the MLC eyes. But because of our collaboration with the forensic department now, this process has got streamlined. This is the kind of form which is being filled, and we have a no objection certificate that we obtained from forensic medicine for retrieval of eyes, and we go ahead and we take the eyes. It has made a very big difference to the quality of eyes that we are collecting now. And of course, usage of alternate tissues, we were forced to use a lot of tissues. This is just the Tenon's graft that we had to do for corneal perforation. We are doing refractive surgery, which is SMILE, in which a corneal lenticule is extracted. We have used in a lot of patients, the SMILE lenticule, and they have all done well. Cyanotic glue, of course, the survey which was published in the Indian Journal of Ophthalmology showed that almost 75% of perforations were being treated by cyanotic glue. In very desperate measures, this happened when there was complete lockdown, and this patient came, and I used a huge piece of sclera. This patient, once the corneas were available, underwent a successful corneal transplant. And this is a sclera. We can use this. You can see the huge perforation. This is one eye. He was blind in the other eye. So it was so important to try to save this eye. And this patient, now it's been almost a year and he's doing very well, and he's with 6 vision in that eye. So desperate times call for desperate measures, and I think we have tried our best to do the maximum amount of service for the blind patients that we present to us. Thank you. You are muted, Dr. Rakesh. You are muted. You're not audible.
Okay. Oh, thank you, Dr. Amit. And your suggestions are well taken, and that will be included in the representation we'll give to the Dr. Mahatme. There's lack of financial support for keratoplasty surgeries, as the issue is that you have an eye bank society, but you are considered as a government eye bank. So that is an issue. I think that should be sorted out between Director Health Services UT and between the PGI. And then you said about the 3 months training in PGI. That is a good idea. And earlier the NPCB used to sponsor candidates for such trainings, even in PGI. I don't know it is happening now or not. And the good thing you have told about the medical legal cases, you have been able to retrieve 74 eyeballs or 74 eyeballs with the help of the police and with the help of the HOD forensic. That is a very good thing. I think we all need to learn from it. So thank you, Dr. Amit. And now I'll request Dr. Ramesh to please let us know about his viewpoint. He is, I think, the most well-known eye surgeon for keratoplasty surgeries in Punjab.
Dr. Kesh?
Yes. Yes, sir.
If you give me a minute.
Yes, sure.
Can I share one patient who's a bilateral blind?
Okay.
Sitting in front of me, with a good quality of tissue, we can definitely, do a good surgery and can get a good results. If you say, if you permit me, I can share the photo on this state lab itself.
You can share the photograph, sure.
Just hold on.
Okay.
Just a second.
Okay. Yeah, that is good. Though it is not very, the photograph is not very large, but still we can make out. The excellent surgery you have been able to do.
And that's the excellent tissue which has given this bilateral blind person to move independently today.
That is good.
This is your efforts, your promotion.
Thank you.
Thank you, Dr. Shkeen, for sharing the photograph. And now I'll request Dr. Ramesh, who is Medical Director, Punarjot Eye Bank, Ludhiana, Advanced Corneal Transplantation Center with the NABH accreditation. He's done a pioneering work in eye banking at grassroots level in Punjab since 1991. So we welcome you, Dr. Ramesh. Please let us know your viewpoint and your suggestions. Dr. Ramesh, are you with us?
He's mute.
Dr. Ramesh,
You are mute.
I think you are muted.
Now,
Yes.
first of all, thank
You are audible. You are audible, yeah.
So I enjoyed the whole session, and I always work as a humble. So in the future, whatsoever responsibility given to me as an duty, I will abide by, and we work for the cornea. So I have no more word to say. Only congratulate you and continue the same things. Thank you.
Thank you, Dr. Ramesh, and you are doing a wonderful work in Punjab, and we are thankful to you. So now I'll request Dr. Karamjit Singh. So he has done MS in 1999. He is Professor of Ophthalmology in the Regional Institute of Ophthalmology, GMC, Amritsar. And he's performing cornea surgery since 2003 and is associated with us since 2015 in the cornea and the blindness backlog-free initiative. So Dr. Karamjit, please let us know about your suggestions.
Thank you, Dr. Kesh. First of all, I would like to tell the situation of eye banking in Punjab because Dr. Niti has not joined. In Punjab, we have 3 eye banks in government sector, 2 eye banks in private medical colleges at Ludhiana, and 3 eye banks in private sector. So total 8 eye banks are there in Punjab. And we have 22 corneal transplant centers, which are affiliated to various eye banks outside, mostly outside state as well as in our state of Punjab. And we have only 4 eye donation centers in Punjab till now. So regarding the various issues faced by government medical colleges, I would like to highlight few of the issues. First of all, the Eye Bank of Amritsar is one of the oldest eye bank established in 1983 and by the eminent surgeons of that time, Dr. Seelal, Dr. Daljit Singh, Dr. Sansar Singh Sangha, and a few more. Since then, it is working. We are registered with under HOTA in 2007, and we were performing average 250 penetrating and other keratoplasty procedures till 2019. And we are also giving training for retrieval of eyes to ophthalmologists, general medical practitioners, ophthalmic officers, optometrists, staff nurses, for retrieval of corneas, and after that transport of to the nearest eye bank. So I would like to highlight that our eye bank is a eye bank training center, as Dr. Ashok and Dr. Amit highlighted that training center should be there. Our eye bank is a registered eye bank training center with the Ministry of Health, but till date nobody came to receive the training of 3 months in government as well as in private sector. The challenges faced by the government eye banks, especially the Government Medical College Patiala, Amritsar and Faridkot, actually there is a lack of adequate funding by the state government to run the activities of eye banking. Previously, we were receiving funding from a national program for control of blindness and visual impairment till the period of Dr. Kesh, when he was deputy director and in charge of NPCB program. But now these days we are not receiving any financial aid from Ministry of Health or from our state government. And also we have inadequate trained manpower, like the eye bank technicians. So we have only one eye bank counselor in Government Medical College, Amritsar. So one thing I would like to highlight that eye bank counselor should be there in each and every eye bank in medical colleges and at district level. So Dr. Kesh, this is one point that I would like to highlight, that eye counselors, the grief counselors, eye bank counselors, or eye donation counselors should be there at district level to motivate the general public coming to the district hospitals for eye donation. Then one thing that I would like to highlight, that in government medical colleges of Punjab or in India, the eye bank should be treated as a separate unit. It should be treated as a separate unit with a separate in charge of eye bank, separate faculty member in charge of eye bank to run the eye bank activity smoothly. And one thing more I would like to highlight, that we started hospital cornea retrieval program way back in 2016. And there was substantial increase in our eye donations from our hospital only. So we started in 2016, but in the COVID era, because the Amritsar Medical College is level 3 care hospital in the COVID. So this hospital cornea retrieval program is not functional, but we will starting the hospital cornea retrieval program soon in our medical college. Rather, only today only we have meeting with our principal and medical superintendent to start this program again. So we received 136 eyes in 2019 from our hospital cornea retrieval program only. So I would like to highlight that hospital cornea retrieval program should be started in every medical college, whether in government sector or in private sector, as well as the bigger districts like district Ludhiana, Jalandhar, Patiala, Amritsar, Bathinda, like that, where now the government has placed 3 or 4 ophthalmologists in each district hospital. So I would like to say that in all 23 districts of Punjab, now there are 2 or 3 ophthalmologists in each and every district. So eye bank should be opened at district level, as our today's chief guest, the member Rajya Sabha, Dr. Vikas Mahatme, highlighted that eye bank should be opened at each district level. And also there is a need of apex eye bank. Need of apex eye bank is there. I think government should open apex eye bank in Punjab also, whether in medical college or even in outside medical college. So these are the few points. The next is in 2016 we started a program of prevention of corneal injuries. Prevention of corneal injuries with the few NGOs and with the help of Agriculture Department of Khalsa College, Amritsar. So we also we motivated various agriculture workers to wear protective goggles, and we also motivate some industrial workers in the Amritsar to wear goggles, protective glasses. So like that, we should also motivate the NGOs and the other people for prevention of the corneal injuries, so that we receive less number of patients with corneal injury, especially in this border belt of Punjab. We are receiving patients with the corneal injuries from the agriculture sector. Similarly, in other districts like in district Ludhiana or in district Jalandhar and in Bathinda, where the industrial units are more, so they receive corneal injuries from the industrial areas. So there we should encourage the NGOs to work there for prevention of corneal injuries. So these are the few points that I would like to highlight. The most important is that every district hospital should have eye bank and that should be registered with the appropriate authority with adequate staff and adequate facilities, because we are now having more number of ophthalmologists at district level. So hospital cornea retrieval program should be encouraged. Rather, we have seen very good results in 2018-19. So these are the few points that I would like to highlight.
Thank you, Dr. Karamjit, for sharing your experience and your suggestions. So I think there should be a more coordinated efforts with Dr. Neeti and Dr. Reeth. She's now Director NHM. So you can please coordinate with them. And I think there's some discrepancy in the number of EDCs. Maybe 4 are active, maybe others are dormant, but there are, I think, more number of EDCs. And it is good that Government Medical College, Amritsar, it is doing cornea surgery since 1983. And with you at the helm of affairs, I'm hopeful that it will regain that glory. So financial aid, as you said, is not there from NPCB. So it is a local issue. I think it can be sorted out. And definitely the iBank manpower, especially the counselors, they are not there. So it has to be taken. We will also take up with the MD NHM. So you can also take up the issue whenever there's a meeting. And HCRP definitely, as Dr. Mahatme also said, that it has to be activated. And another good suggestion is we need to do prevention of eye surgeries so that we have lesser number of patients for keratoplasty. So thank you, Dr. Karamjit. And now we have with us Dr. Rohit Gupta. So he's in private sector, and he's director of the Tri-City Eye Hospital in Mohali. So I'll request Dr. Rohit Gupta. So you have listened to all, and you may just convey the points which has not been taken up with by the others. And I may also add that he's working as a consultant at Guru Ka Langar Eye Hospital, which is a very famous institute in Sector 18, Chandigarh. So over to Dr. Rohit Gupta.
Thank you, sir, for giving this much opportunity to share my suggestion in front of the stalwarts of corneal surgeon. I'll be sharing my screen. Is it visible, sir? So,
yes, sir, I can see that.
It's visible. Okay. So, as all the experienced surgeons, they have shared their views and suggestions on how to improve eye banking and corneal transplantation post-COVID era. I'll be sharing few of the practical aspects to improve the eye banking. First of all, training of eye bank staff is one of the most important aspects in improving eye banking. As we know, the staff, they are the backbone of any institute or any organizations. So as Dr. Amit Gupta also had suggested, like training of eye banking staff, how to don and off the PP kit and everything. So training has become very important, especially post-COVID eras. Like frequent hand washings during collection of the eye donors and sanitizers of the hand. They should be provided with adequate number of gloves, sanitizers, and disposable gowns. Masks should be mandatory at all workplaces. Social distancing is very important. If healthcare worker is exposed to the COVID-19, he should be quarantined for 5 to 7 days. Now the day has been reduced and tested as per the government protocol. Initially it was 14 days, now a day has been reduced. So after removing the PP kits, adequate washing of hands, use of alcohol-based sanitizer is very essential. Rest all the suggestions that we have given by Eye Bank Association of India in AIS. The cornea transplantation in COVID era. So the resuming cornea transplantation in the post-COVID, it requires multidisciplinary approach from eye bank technicians, nurses, surgeons, and the new infection protocols, which requires training and familiarizations. So patient education regarding COVID-19 results and risk of transmission should be discussed thoroughly. before undergoing corneal transplant surgery, with anticipation of delay in the preoperative processes. And there may be cancellations of surgery also because of transportation, because of lockdown, and because of unavailability of the corneal tissues, good quality corneal tissues. So surgeons performing corneal transplantation under GA, they have to consider using full PPE and N95 masks to avoid the risk of aerosolization during intubation and extubation. The last one, the most important, is the economic impact of COVID-19, which includes increased costs from the donor transport, testing, PPE related. They must be considered in the long-term planning and the sustainability of the resuming corneal transplant services. So this is the teleconsultation in COVID-19 era. It's my experience, during this lockdown period. It is important to share the details of the contact details of doctor with the patients, especially in the lockdown period, so that they can avoid frequent follow-ups. If they cannot come for follow-up, we can do video call or video conferencing, or we can also ask the photo of the operated eye of the patients. We also have to stress the importance of compliance of medications so that the graft remains clear. They have a less risk of graft rejection and graft failure. If they cannot come for follow-up by any means, they can have local follow-up at the local ophthalmologist, so that their corneal remains clear and the visibility remains maintained. So thank you. These are a few of my suggestions which I have to share.
So thank you, Dr. Rohit. So your suggestions are well taken, that COVID protocols in notice, they need to be followed, and it has to be a very coordinated effort. So it has to be a very coordinated effort with all the stakeholders. And you have taken up this economic impact of COVID-19. So we need to, try reducing the cost of the corneal tissue we normally take from the eye banks. And the teleconsultations, they are an in thing nowadays. So thank you, Dr. Rohit. So now I'll request Mr. Arun Verma. He's our Director of Finance and Operations, to please summarize the consultation and also propose a vote of thanks. So over to Mr. Arun Verma.
Yeah. Thank you very much, Dr. Rakesh. I really feel delighted and honored to thank Padam Shri Dr. Vikas Mahante, respected member Ajay Sir, for his generosity to accept our request to join the consultation as chief guest. Thank you, sir, for joining us and for encouraging us with your blessings. He himself is a very eminent eye surgeon of international repute. I thank our guest of honor, Padam Shri, Professor Dr. Jagatram, an eminent ophthalmologist and Director PGMR Chandigarh. Sir, we are extremely grateful for your blessing which you have always been bestowing on us in all our endeavors. I also welcome our guest of honor, Dr. Radhika Tandon, Professor of Ophthalmology, RP Center, AIMS, Delhi. Ma'am, we are extremely grateful to you for always having inspired us and guided us through our efforts on the public health issues. I thank all the panelists, Dr. Ashok Sharma, Director Cornea Center, Chandigarh, Professor Dr. Shakeen Singh, Director Cornea Center, Chandigarh, Dr. Amit Gupta, Medical Director, Puranjot Eye Bank, Ludhiana, Professor Cornea, Cataract and Refractive Surgery Services, Advanced Eye Center, PGI, Professor Dr. Karamjit Singh, Professor of Ophthalmology, RIO GMC, Amritsar, and Dr. Rohit Gupta. Sir, we are extremely grateful for the recommendations and suggestions and the challenges put forward by you, and we will definitely include those in our recommendations which are being drafted. Dr. Jagdeep Singh Basoor, I thank Dr. Jagdeep Singh Basoor, SPO NPCB and VI Haryana, and Dr. Rana Singh, SP NCB and VI Chandigarh, for presenting the eye donation and eye banking report 2021. We feel really excited after seeing the work being done in these areas. I thank Dr. Rakesh Gupta, former Director Health Services, and Punjab, and Director and President Cypher, and Dr. Sonu Goyal, Professor, Department of Community Medicine and School of Public Health, for organizing this national consultation, as well as moderating the panel. I really thank especially thanks Dr. Sonu Goyal for making suggestions on this in this field with perspective from the public health. I also thank all our corneal surgeons who have been associated with the CBWeb program movement since 2015. I also thank all the staff of the Cypher and PJML associated with organizing this consultation, especially Dr. Mahindra and Mr. Saurabh. I also thank all the participants who have joined today's event through Zoom link as well as on the YouTube, as well NGOs for their immense contribution in eye donation and eye banking. I thank everyone. Now, as you know, our chief guest and guest of honors and our panelists have given very useful inputs on the challenges being faced under the NTBC and very relevant suggestion and recommendation to overcome the challenges to take the program further to achieve our goal. We have noted all the suggestions and recommendations and will incorporate the same in our draft recommendations which are under preparation. We intend to share the final draft recommendations with all the participants and the experts for obtaining more inputs and suggestions to be incorporated before forwarding the same to Dr. Vikas Mahathir for further pursuing with the quarter consent. Thank you, everyone. Thank you so much.
So thank you all. Thank you all.
Thank you. Bye-bye.
Dr. Karamjit. Thank you, Dr. Rajiv. Rohit, sorry.
Thank you all of you.
Thank you very much. Thank you, Dr. Kesh.
Dr. Sonu.
Thank you, sir.
Thank you, sir.
Thank you.